Welcome back to With the Doctor, and I'm your host, Dr. Abhishek Papneja. This video, I want to go over how to fix a severe lumbospinal herniation. When I'm talking about severe, I'm talking about the degree of pain or the degree of inability of doing your daily life chores. Basically, what that means is that you're not able to sit, you're not able to lie down, you're not able to stay standing, you're not able to get up from a seating position, you're not able to get into a sitting position, you're not able to eat your food properly, you're not able to go and use a restroom, you're not able to lift anything, maybe even a pound of weight you're not able to lift. So it could be that severe. You're on 3 different medications and they're still not working, to the point that you're being told by the physicians to get on controlled substances, which is a derivative of morphine or codeine. Now, if you're in that state, right, you could be in a situation that you're completely unfunctional. And that is why I have come up with 6 techniques that will help you get out of your severe state and bring you into a more functional state. And once you're into the functional state, watch my other video. Let's just divide the treatment into a 3-step procedure. Remember, in the neck video we talked about elongation to relieve the pressure of the spine. We're going to go ahead and continue an elongation of the lower spine, but we're also going to add an extension, as we discussed that flexions cause it to worsen up. Finally, we're going to end the management with a twist of the spine. The twist is very important because when you twist, not only do you elongate, you're also getting the extension effect as well. Now, the twist is like literally the only thing that would save you from a sacral herniation. So the first pose, what we want to do is Sit Pratasana, meaning that standing prayer pose. So what we want to start off with is getting the feet into proper position. So what we want to do is get the toes together, heels apart, just like that. From here, we want to rotate that hip forward. A hip rotated forward looks like this. It's completely flat with the back. What happens in this pose, the weight of your upper torso is sitting right on your hip joint, which is where it's supposed to be. To rotate that hip, a technique that I found very effective is simply to relax your buttocks, take one of the hands, put them right on the butt crack, right? Once the hand is in the butt crack, like this, what you want to do is squeeze that butt. Squeeze it. You'll feel the materials of your cloth going into your butt crack, which is fine. Now take your hand out, memorize this muscle position. This is going to be your bread and butter for the rest of your life if you have a herniated disc, or if you want to prevent yourself from getting this herniated disc. So keep practicing this. Contraction. When you contract this, what ends up happening is your feet will bow. We don't want that bowing to happen. So at this point, we want to spread the toes and press down. So spreading the toes, pressing down, keeping the butt contracted. Remember, the cheeks are pushing in. Now you've contracted all the muscles in the lower leg, and if you haven't, contract them. You're contracting your calves, you're contracting your hamstrings, and your quads. Now, your body should be sitting on its hip bone. The next step is to elongate this chest without extending the chest backwards, right? So, to do that, we're going to rotate the shoulders backwards, and then we're going to lift the chest, keep the tailbone in, and now lift the abdomen as well. And finally, we learned in the neck video how to tuck in the neck. Go ahead and tuck that neck in. So now you are completely elongated. Your entire spine is elongated. From this position, we want to just get into the prayer pose. Take your thumbs, put them together, put them on your chest bone, take the fingers, spread them apart, and just relax. Do it every day for 5 minutes. Just standing like this, you will have significant relief of your pain. Go to the second step. It's a modified version of this. To do this, we're going to move over to the wall. So now we're against the wall. What we're going to do is we're going to put our heels against the wall, and we want the feet hip width apart. If you notice, there's a gap behind my back, which is normal to have this gap. What we want to do is fix the hernia. To fix this hernia, we want to flatten the back as far as possible. With the heels against the wall, we're going to now bend our knees, rotate that hip to flatten the spine as much as possible against the wall. If you're not able to do it with the heels against the wall, bring them forward inch by inch to find the perfect angle for you. So now at this position, we want to contract the abdomen, straighten the abdomen, roll the chest backwards, and raise the hands. You can do this multiple times throughout the day whenever you're feeling these symptoms. The more often you do this, the faster your recovery will be. So now what I'm going to do is I'm going to teach you 2 exercises which require you to lie down. If you have a herniated neck, make sure to go ahead and elongate that neck. Otherwise, you're fine, just the way you are. Now, what you want to do here is we want to flatten the curve on the back. We understand that the curve is normal, but to put the hernia back in, we got to elongate the spine. To elongate the spine, we got to flatten it so it can get elongated. So, what we're going to do is we're going to bend the knee like this, come up, and flatten that back. Right? Another way to flatten the back is to bend the knee and rotate the hip. Now, what I want you to do is to contract this abdomen down and then pull with your back muscles down as well. So your entire body is pushing itself down and pulling itself down. And then you can just lie down the legs in a bent form. And this entire time, I want you to keep your body contracted over here and at the back, at the abdomen and at the back. And you want to hold this as long as possible. And doing so should help with elongating the spine. This asana is a modified version of Hastapada Angustasana, meaning hand to your toes. So what we want to do is we want to raise that one foot, put our hands to the side, and with that, keep the foot itself contracted like such while it's up, and keep the lower foot contracted like this as well, facing upwards. And now we're going to twist to the side. So we're going to twist to the side. If your right leg is up, twist towards the left. Cross the twist. And now instead of putting your foot down to the floor, we don't want to do that. We want to hover this foot in midair, and we want to take the other hand and reach all the way across. So basically, now we're in an angle twist. Now with this pose, you can keep this hand wherever you want. We want to act as if we want to stretch the muscles as if we're being teared apart like this. So I'm going to reach over here, and I'm going to reach with my foot, let go of the flex that I had, extend it. You can also take that extended leg that's hovering above the ground and oscillate it up and down, right? And if you're not able to feel anything, rotate that leg up and down and see where you feel the most amount of pull in the herniated region. Now again, if you're right, this is for the right leg, so the right hernia. Now for the left leg, we'll help with the left hernia, and this will go across like that. Right? Hover it, stretch as if you're being pulled, oscillate the leg, and bring it back. You can do this multiple times per day to get the results that you're seeking. Now this particular Hastapada Angustasana is really good if you have a herniated sacral disc as well. Because like I said, when the spine goes down this way, nerve roots over here come up like this, but the nerve roots down here have to turn, then find their foramen, and then come out. And because this entire region is fused, there's nothing moving here. So twists are really good for this region. All right, final two exercises. You will love these. They're very easy. First one, it's called Ardha Mastanasana, but we're not going to do the complete one. We're just going to do a half one. So what we want to do is we want to cross our body and go into a half body twist, essentially. So we're going to take one of the legs, put it against the knee with the foot, then cross it over. So the foot and the knee are aligned, right? The arch of the foot and the knee are aligned. Now what I want you to do is take, if it's the right foot in this case, I want you to take the right hand and reach as far back as possible, right? To the opposite side, on the left side of the mat. Then take the left hand and then cross. Okay? You might feel a crack, which is good. You might feel a pull, which is also good. Both are good indications that something is happening. Next thing you want to do is we want to complete the twist to the opposite end, like that. Remember, when you're doing a twist like this, whichever hand is at the back, you want to pull yourself towards that hand. Repeat on the other side and you should be good to go. Hold it for 10 breaths minimum, but if that side is where the active hernia is, hold it for 20. The final exercise is called the pigeon pose. To get into pigeon pose, what I want you to do is get onto your force, right? Like this. Then take one of the legs, stretch it out all the way. Now once that leg is stretched, take the other leg, which is bent, bring it forward, okay? Now when you bring it forward, the heel will be aligned with your groin area, which is a good thing. Now, you're in a pigeon pose. But we want to fix the hernia. How do we get that done? Well, take your hands, get on your fingertips, okay? Now, if you're not able to bring your hands close to your body, it's fine. Bring them out far back. Start from the further apart from your body and push yourself back, okay? Push yourself back. You'll feel something over here, and that's the extension of the spine now. We're finally extending the spine. Everything that we did before was elongation or a twist. Now we're going to extend the spine. So if you're comfortable like I am, I'm going to bring my hands all the way down to the sides of my body, close to my body, and then I'm going to push up. When I push up, I elongate and I extend. So elongate the chest and extend backwards. You'll feel it at the back. Tuck in your neck so you don't damage your neck while you're at it. Now, what I want you to do before you finish off is twist into this pose. So keep yourself up, breathe in this for 6 to 10 breaths, and then twist with one of the hands. When you're looking to the side, what I want you to do is to look at the crease of the elbow, right here. When you look to the side, I want you to look to the crease of the elbow, because if you look into the air, what's going to happen is you're going to damage your neck. We don't want to twist the neck. We want the chin to go towards the shoulder, and we want the eyes to go towards the crease of the elbow, as such, right? Then I want you to do it to the opposite side as well, like such. That twist would help bring a twist into the lumbar sacral region as well. Then I want you to finish it off by bringing yourself back into the pigeon with your feet flat to the ground, The back foot is flat to the ground and pull yourself forward. Roll yourself shoulders back and pull up like that. And then relax. These are my 6 recommended exercises that will help you recover from severe herniated, bulging, or slipped disc syndromes. I hope you liked this video, and if you did, please hit the like and subscribe button and we can stay connected and you will get informed with any uploads that I make. And at the same time, if you have any comments or questions, send a message down at the bottom and I'll reply to you. And as always, make sure you talk to your physician. And until next time, this is Dr. Papneja signing off.